Hello, my name is Melissa Scholars, and I'm a BSN student at UCPI University. I am currently enrolled in the Nursing 456 Senior Practicum course, and my project is about successful patient education to decrease and prevent hospitalizations for kidney failure patients. This education was created in order to decrease the hospitalizations in patients who have kidney failure. This population of patients have a higher rate of hospitalizations simply due to them having kidney failure and are related to the most common causes. Two of the most common causes of kidney failure are uncontrolled hypertension and diabetes. The damage of these two diagnoses can also have repercussions after the diagnosis of kidney failure. Another common reason for admissions to the hospital are due to infections, heart failure, and pneumonia. Anemia and gastrointestinal bleeding are also considered secondary complications to chronic kidney disease. My senior practicum goal was to design, implement, and evaluate a patient education program for staff to deliver to kidney dialysis patients on prevention of hospital admissions and readmissions. My overall goal of this project was to improve patient outcomes and improve their quality of life. Dialysis is a full-time job for the patients who spend a minimum of 3 hours, 3 days a week. If we can understand what the most common causes are, we can work together as a team to decrease these admissions. There are 3 objectives to achieve the patient education goal. Design phase had research studies and evidence-based practice guidelines on the most frequent types of hospital admissions for CKD and AKI patients and patient education. The education research was to understand what works best for the patient education and the most common obstacles of it. The implementation phase was implementing the new patient education plan for preventing these admissions and readmissions. And the evaluation phase evaluates the teammates' understanding of the education that we provide to the patients, evaluating the feedback, and then evaluating the entire plan for accuracy and making any additional changes. Currently, the company requirement is once monthly documented delivery of education. My new plan will include weekly focused education topics that will be provided by all teammates within the facility. It will begin during initial assessment by the PCTs and followed up by the RN. The topics will be discussed at daily homeroom meetings to improve knowledge and confidence for all teammates. The weekly education will be laminated and displayed on the television, making it able to be cleaned between patients so infection control is addressed. An example of a schedule might be week 1 mistreatments, week 2 different modalities offered to these patients, week 3 are the signs and symptoms of unhealthy blood sugar levels, and week 4 would be fluid and sodium control. I discussed with teammates the biggest obstacles they felt kept them from successfully providing education to our patients. I received feedback of time constraints and resistance from patients. And another important factor is the confidence of our teammates. During this project, I completed one-on-one teach-back sessions, but I also took the time to observe from afar so they didn't realize I was paying attention monitoring their techniques. I was able to see where they shine and where they needed some help to be successful. I was able to see how they interacted with the patients and how easy it could be at times for the patient to redirect the conversation. My goal became to improve the teammates' knowledge and confidence in the information they provide, improve how they deliver it to the patients, and make it more visible so the information becomes more familiar to the patients. Red flags are phrases or changes seen in a patient that need to be reported. Oftentimes, patients will tell one healthcare worker one thing, but not convey that message to the nurse or the doctor. These common phrases are placed on red flags and attached to the computer screens that are chairside at each machine. It would be a great reminder for the PCT to report these sorts of phrases to the nurse so that an assessment can be done and reported to the doctor. Some of the common red flag phrases that we will put on those flags are, I'm feeling really tired lately, or when I lay down at night, I feel really short of breath, or when I walk short distances, I feel really short of breath. Another might be, I have felt a little under the weather and have the chills, but I don't have a fever, or my access hurts and is looking really red or swollen. Lab alerts that indicate a change in a level, such as potassium or hemoglobin, alerts the nurse. The nurse always contacts the doctor redraws the lab, and makes any necessary changes per the MD order. But along with that, now the nurse needs to grab the appropriate education pieces and start a new education session with the patient. The example I will use is for potassium. So someone's potassium is too high. So we need to educate about what can happen with hyperkalemia and what the patient can do and what the facility can do and what our goals are. We also need to do a new medication reconciliation and a follow-up to confirm the understanding still exists, as well as address any new issues or misunderstandings to improve the patient outcome. A change in condition due to excess fluid gains or mistreatments means that the entire team is on board. The PCT will grab the assigned education to include managing your fluid and making every treatment. And such pieces of these company-specific education are excellent ways to explain why it is so important to adhere to fluid restriction and attend all your scheduled treatments. The PCT will begin educating while they're doing the initial assessment of vital signs and initiating the treatment. And then the nurse will come behind them for their assessment and follow up with any questions or concerns, reiterating the education. This project addressed ways to make the teammates more confident with delivery of the material because I understood what they were teaching. The topics were discussed during homeroom meetings daily in order to answer any questions and provide education to make them feel more confident and knowledgeable. By placing the education in front of the patient on their personal TV and during initial assessment by the PCT, it became more common and more familiar to them. It also causes them to ask more questions when they're looking at something to read. Whether it's discussed or not, they're seeing it. It becomes education that they remember. Red flags placed on the chairside computer are great reminders for PCTs so that all of the pertinent information about the status of the patient is relayed to the RN and the MD. Oftentimes, little key phrases about how a patient says they feel can indicate something is going on that we can't see. Teammates were able to learn ways to make the education work for them and reduce the feeling of not having enough time. They were able to integrate it into their 15 minutes with the patients as they moved from the lobby to the treatment chair and hit start on the machine. Reactions to lab alerts and changes in condition involved a more structured plan containing consistency and repetitive sessions, providing the education to reduce chances of admissions. A great example is fluid overload. As a nurse, I see the patient has excessive fluid gains. I can educate on the effects of the fluid gain along with my PCT. I can offer an additional treatment for 2 hours to remove additional fluid and reduce the chances of a hospital admission. Initially, I thought I would need to create new education pieces, but the truth was it wasn't the pieces or the tools we had, but how we did it that would be the most impactful. We required more scheduled timing of education as well as approaching it from a proactive nature as well as a reactive nature. We needed to improve visibility of the education so that literally it was in their face on a daily schedule and changing topic each week to improve familiarity of the topics. We needed to add a plan once a lab alert said something was wrong, indicating a change before. This project sharpened my skills at assessment. Not only did I improve how I currently work with my patients, but it also caused me to assess situations between teammates and patients, allowing me the ability to see where we can do better for our patients. This journey has also improved upon leadership skills as I work with teammates to improve the education delivery. Not only did I work with teammates on making them more confident, but working through this also improved my confidence as I worked to educate my patients. I was able to find new ways to reach them and impact their care. I also sharpened my training skills, learning what changes needed to be made to impact my teammates so that they could sharpen their skills to be better educators and improve patient outcomes. Sentinel event.